My name is Harold Hom. I work as an intensivist at the intensive care department in the Medisch Spectrum Twente hospital in Enschede, the Netherlands. In our department we see and treat patients that require intensive care. Important life functions need to be monitored or controlled, for which they absolutely need to be in hospital. To assist us in monitoring and controlling life functions, we use ultrasound imaging. We use it for diagnostics and guidance during interventional procedures in several situations.
Ultrasound at the intensive care is used as an overall check on the health of the patients. The examination should lead to information for the physician or is an indication for more in-depth ultrasound examinations by specialized sonographers. It is important to know that examining the patient with ultrasound requires some time to perform correctly. Therefore, it is important that this is not conducted in an acute hospital setting. The patient should first be stabilized in terms of life functions, after which the ultrasound examination can take place. We can distinguish three major purposes for ultrasound on the intensive care. First, it can be used to guide a basic intervention frequently performed at this department. Some patients need medication for a longer period, for which they require a so-called central venous catheter. To minimize the risk of complications during the insertion, such as a bleeding or a collapsed lung, ultrasound guidance can be used. Secondly, patients at the intensive care may have too much fluid in their lungs, lung edema. Since this can be life-threatening, patients should be released of the edema. If this is noticed by the physician, he can decide to use ultrasound guidance to make a small canal to release the fluid. As a third purpose, Dr. Hom can check the functioning of the heart. This hemodynamic monitoring provides the physician information on how the heart contracts, if there is fluid around the heart, how the heart valves function and whether the patient is underfilled or not. When more specialized information is required, the cardiac sonographer will come in to do this. The rapid assessment of cardiac echo is the subject of a mini-case later in this course.
In the next video you will meet a patient at our department who needs medication for a longer period. The patient will receive a central venous catheter in his vein, which we will insert under ultrasound guidance.